All right, sure. Hi, everyone, and thank you, Tulsi, for inviting me. I'm Richa Parikh. I'm one of the third year fellows at Carmanos in Detroit, Michigan. I did my med school. I went to med school in Mumbai, so I'm an IMG. And then I did my medicine residency in Little Rock, Arkansas, in University of Arkansas for medical sciences. And then I actually worked for 2 years as a myeloma hospitalist. It was like a BMT hospitalist position. And then subsequently, I applied for fellowship and matched here in Kermanos, and I'm almost finishing up now. So my clinical and research interest is all in multiple myeloma, and I'm going to be looking for like an academic faculty position in myeloma. So that's a bit about me. Nice to meet you all, and good luck for the application season.
Thank you, Dr. Parikh. Matt, floor is yours. I think there is a little bit of a lag. Matt, can you hear us? Okay, so while Matt is we're working on that, Dr. Parikh, can you, the first question that just came up was how late into this interview can we, like, it's been very slow for many of us. So I think when we see our colleagues in scheduling for nephrology, ID, cardiology, and we're like, okay, what's happening? So what was your experience and what advice do you have for people who are still waiting for interviews?
No, I think it's fairly early still because I remember that I started getting most of my interviews in August end. And that's when actually I started scheduling a lot of my interviews. So I think it's fairly early still. You guys just applied like July 15th or so, right?
Correct.
Yeah, I think, yeah, there's time. And there was a group, I think it was called, it was one of like Frida's group or Heme fellowship applicant group where everyone would post whenever they would get interviews. And so that was kind of like a fair way to know if the program that you're interested in or have applied to has started sending out invites. And if they have and you don't have an invite, then you can still wait. There's like waves in which they send interviews, and so depending on if they've picked a few applicants to send out interviews in the first wave, and then as people decline the invitations or cancel invites, and then there'll be more openings. And so, but I think the majority of my invitations came in like August end.
Okay, that's very reassuring. And Matt, if you can hear us, can you speak to us?
Yeah, sorry, my call dropped out.
Perfect. Floor is yours. I'd like to introduce yourself.
Hi everyone, I'm Matt McCartney. It's a joy for me to be here and give my perspective as well on kind of the interview process with the fellowship. I went to medical school at Lake Erie College of Osteopathic Medicine in Erie, Pennsylvania. After that, I actually went to Lansing, Michigan at McLaren Greater Lansing, where I did residency. And now I'm down here at University of Florida, Jacksonville, in Heme. And yeah, it's been interesting as a DO applicant to kind of go through the system. And I hope that I can help ease some of your stresses now as you apply for fellowship as well.
Thank you, Matt. And I think I'll come back and come to you with our first questions. And Dr. Parikh was saying, how was your interview experience when it comes to getting that first invite? A lot of people are on edge. We see other specialties already scheduling. How early did you get your invite, and how late did it go? All the way. We've heard some people get interview all the way up to November. So thoughts on that?
Yeah, so I received my first interview invite, I would say beginning of August, end of September. And I received my last invite closer to end of September. But yes, I agree. A lot of the fellows here got interviews late in the season as well. So if you're not getting any right now, I would say don't give up hope yet. It's still very early in the process.
Okay. And what about thoughts on, were you ever asked to submit additional essays? So we're hearing some of the programs like today, Maine Medical Center, send out invite. We reviewed your application. Now you get another invitation to submit more essays. Do all programs do that, or what is their idea behind sending additional essays, and how is this being evaluated, or what is there any thoughts around it? I'll ask both of you, whoever wants to go first.
I don't think that I had that kind of request, but I guess if they are kind of tied between a few applicants, and if they need more clarification, maybe that could be a reason why they have asked for more essays. But I wasn't in that particular situation.
Okay. How about you, Matt?
Yeah, same with me. I didn't have to submit any other essays. I know with recent changes to ERAS, like the geographical preference thing is brand new this year. I think programs might just be trying to whittle that number down as much as they can. So I would just do your best on those, and I think that's a new thing that we might start seeing more and more frequently.
And Dr. Parikh, I see that you have a focus on myeloma, where the programs that you applied, were you specifically seeking for additional myeloma focused training, and they were strong in that area? And did you interview at other programs who may not have a big focus on myeloma, but there are still faculty treating? Like, how do you approach if you are really into a niche area?
So I think I would still apply pretty broadly, because you go in with a particular interest, and by the end of fellowship that interest may change, or even other life things can happen. Like, for example, if you're married and like your spouse has to be in a particular location, and you don't have like a myeloma opening in that particular location, but there's like a breast opening or a private practice opening. So I think it's best to like keep your options and go with the training program that is best suited to train you overall well, and so apply broadly. So for me too, like even despite having a particular interest, I applied broadly all across, and definitely once I got my interviews, programs that had prominent myeloma faculty, or people that I have identified already as they can be my mentors when I join in, I kind of rank those programs higher up in my priority list. But going in, I think be pretty broad, because the most important thing is to get in and get a spot into the fellowship program, and make sure that they're going to train you well overall, because your interests may really change over time. And my interest was because I worked for 2 years as a myeloma hospitalist, and so it was all related to my exposure. But as I would go through fellowship, maybe there's other things that I start liking. So yeah, go with a broad mind.
Thank you. Matt, did you have any research focus, or what advice do you have for people who may not know what area they might want to focus, except they have really strong interest to become a board certified heme-oncologist?
Yeah, so personally, I didn't have any specific research interest going into fellowship. I had done some research with the fellowship program at McLaren in Lansing, but really nothing specific. And during my interviews, I was asked about what interests I have in research, because again, I wasn't very specific, because the field is so broad, I didn't want to limit myself. And that was actually a really good discussion point for the interview, to talk about. Yeah, I think I'm interested in solid tumor. Okay, what interests you about that, or what areas do you see research going for you in that? And that was a good point of conversation as well. So I agree. I think if you don't have a specific interest, broad is better.
Okay. And now that going back to Matt, because Dr. Parikh, if I'm not mistaken, you're second year fellow or third year fellow?
No, I'm a third year. I just started.
Third year, so you're almost ready to graduate, and Matt just started his fellowship. So how do you navigate through having a research focus or no focus as a first year as opposed to third year? Matt, I'll start with you. You just started. Do you have any guidance from the fellowship program to sort of look into it, or how do you approach it as a first year?
Sure. So my fellowship program gives us 2 months of research during our first year, and that increases next year. And I believe our last year we have 4 or 5 months of research. To be honest, right now, my main focus is getting through boards, which I take within the next couple of weeks. So we haven't even really discussed research yet, but a big thing that I'm doing right now is figuring out of the faculty who has interest in what, who has projects going on, and kind of seeing what options I have. So when I hit my first research month, I can hit the ground running and not trying to figure out what to do for the first couple of weeks of that month.
Nice. How did it transition for you now that you're third year, going from first year to this? Did you want to go into myeloma, right, or you explored other things?
So yeah, no, I have been very, very focused, like, cause I already had like 2 years of background research, and I kind of like developed that interest and wanted to continue. So once I started my fellowship, I was still working on projects that I kind of had to finish from Arkansas. So I kind of kept working on that in like the first year and second year, and took on more projects all in myeloma. So I am kind of a bit different in that way, but most people are not. Most of my classmates are pretty undifferentiated or poorly differentiated, not very well differentiated tumors. So yeah, it's totally fine going in not knowing what you want to do, and yeah, as Matt said, take like a couple of months to just figure out how things are and study for your boards. And again, I did not have to take my boards because I took it when I was a hospitalist in the first year of my hospitalist. So, you know, when I was starting as a Heme fellow, I did not have that burden on me. So that was another difference. And but yeah, like I would say though that Heme fellowship can be very, very overwhelming. So I was telling Tulsi that I know you guys are all stressed about getting interviews, doing well in the interviews and matching. And trust me, all of you are going to match at great places. But I think the real struggle actually starts after you start fellowship, because first year of Heme fellowship really made me feel stupider than an intern. Like I was lost. I had no idea what is going on. Because even as internal medicine residents, we do learn a lot about cardiology, about concrete, about GI. We can do at least the basic management, start somebody on aspirin, statin, Plavix, blah, blah. But Heme is very, very elusive. You don't quite know anything about that part. Like making treatment decisions or how to treat somebody's cancer or staging. So it's very overwhelming. So it's totally fine to feel that way. Matt, to you too, if you're going through that. And it only gets better. You learn a lot. And it's important to be at the right place with good people. So I would say, like, while you're navigating your interviews, try and get a feel for what the culture of the program is, what kind of people there are, and if faculty is willing to teach, and if there will be adequate research opportunities. I think that's more important than knowing exactly what you want to do. I think it's just like having multiple faculty mentors that can teach, that are participating in research. I think those things would be important for you guys to find out as you interview in your season.
Thank you, Matt. Thoughts on, now that you're a fellow in the first 2 months, how do you feel transitioning from residency to this?
100% agree. I think feeling like an intern is a little bit generous. I feel like a second year med student still. You know, it's just a totally different language. Even if you think that your heme knowledge base is adequate, it's astounding how much of a difference it really is. But no worries, you'll do great. All of you will do great. It's a learning curve, just as the rest of our medical education's been. It's awesome.
So my next question is, again, we have Matt with DO. There are some, preconceived notions about DO applicants, just like IMG applicants. So I'll ask, how did you approach being an IMG going into the match? And Matt, how did you go with DO title going into match? Did it make any difference, or did you feel, thoughts on that?
Sure. So you can go first. That's fine.
No, go ahead.
No, that's fine. Yeah. So as a DO applicant, I'm first going to say that I never took any of the steps. I only took Comlex for boards. So USMLE I didn't even study for it. I just took Comlex. The biggest thing that you should know about fellowship is that a lot of that prejudice against DOs doesn't exist. And of course, if you're trying to go to Harvard as a DO, you should, maybe not apply to Harvard, but go for it. Who knows? So what I did personally is I looked at the list of current residents or current fellows. If they had a DO, I would apply. If they didn't, I would honestly just save my money. So to be honest, in the programs that I applied and got interviews at, I would say that being a DO did not hurt me at all. Just because fellowship is totally different, and that osteopathic aspect, and especially Heme fellowship, it isn't even really a thing. So you can definitely match as a DO. And from my perspective, having never taken USMLE board exams, you can do whatever.
Okay.
Yeah, I totally agree with Matt that I think the discrimination is a hard word to say, but kind of the difference is that you would face trying to get into residency as an IMG versus trying to get into fellowship is very different, and it's not felt as much because you're already here, you're in the system, you've done your medicine residency here, and so I think that a lot of lot of programs, what they're looking for is what you did in your residency, and not really. I don't think that bias is as strong for fellowship applications. What matters is your CV. I think that's like the most important thing. And maybe second most would be like your letters. And I know that visa status for IMGs, I think it's more that visa sponsorship, because, there are a lot of programs that just don't sponsor visas. And so automatically, if you are on a J1, you still might be able to cast a wider net. But if you are on an H1, there are really few options. I think there is about like 50 programs or so that would be agreeable to sponsoring that H1 visa. So I think that is like a bigger restriction for IMGs than being an IMG per se.
Mm-hmm.
But if you have like a G1 or you can apply broadly, then I think then you're kind of in the same pool, and what you have done in terms of research or what your CV says about you or what your letters say about you, I think that's what matters. And then, yeah, as Matt said, that look through the websites and the current fellow lists, and then see if they've been kind of IMG friendly. And if they have, then for sure apply to that. And if money is not a constraint, I would even try my luck at bigger programs, and you may never know. I was surprised. I was debating exactly the same thing, whether I should apply to some of these Ivy League programs, but I was a hospitalist, so I did have that extra money to apply. So that's kind of a plus. But yeah, so I applied very broadly, and I was surprised I did get interviews from like Cornell, Emory, like really top programs. And even though I did not match in those programs actually, but it was still good to check out the programs. And I was glad that I was probably the only IMG that was interviewing in that on that entire day out of like 20 applicants. But it's good to at least check out what they have to offer. So if money is not a constraint, I would say apply broadly. If it is a constraint, then yeah, definitely look for programs that are IMG friendly and that are sponsoring visas, and then go for those.
So I'm glad you brought it up, because one of the questions that came in the chat box was, so this is for you, Dr. Parikh. Some programs have a dedicated 1 or 2 year hematology hemostasis track. How are the job prospects for this? And also, how do J1 waiver jobs work out for these positions?
So I think what you're referring to is more of like a benign hematology track. Is that right, Akshit? If so, then yeah, the job prospects for benign heme are excellent because there are a lot of places, including academic places and also private practices that are big enough that can afford some sort of disease focus or specialization are more than happy to have people who are interested in benign heme. I am just in the process of applying for jobs right now. So I've been like frequently looking up the ASH Center and ASCO Job Center and NEJM career centers. And I do see a lot of openings for benign heme. So yeah, so if that is something you're interested in, then yeah, definitely the job prospects are good. I am not on a J1, so I don't know much about the waiver part, but I do see definitely a lot of openings for benign heme. And you would want to clarify that this, if you are interested in malignant heme, I would recommend that you definitely clarify whether this is going to include malignant heme, because my understanding is there is also a 2-year fellowship for medical oncology, and that's what covers the solid onc and malignant heme part. But this one that you're talking about might be just a benign heme fellowship. So if you're looking to treat myelomas, leukemias, lymphomas, you may not be able to do that with this kind of a training. So make sure you clarify what exactly this means.
Thank you. And Matt, the next question is for you. So, and both of you actually. So you submitted your application, and Dr. Parikh, if I'm not mistaken, your class was also the one of our first, like when we tried for residency, everything was virtual. Once you submitted the application, did you do anything extra to continue working on your interest in Heme/Onc application? Like we have ASCO conferences coming up. Did you do more, networking? Like what did you do after this application's going?
Yeah, that's a great question. To be entirely honest, it was a marathon for me to, perform well in residency, get all my application stuff together. That once I hit that finish line, I kind of just took a break, took a breather. I started really looking forward to boards at that point, and I finished whatever research projects I was working on. I think I had a couple case presentations that I had submitted to a local conference in Lansing. So I did that. I spoke with the oncologists at the hospital I was at, but really to really sprucing up my application any further, I didn't really do a whole lot. No.
How about you, Dr. Parikh?
So I actually, I gave it some time, I think, but then like a month or so, and then I do remember, and actually I did want to share that and I don't know if that was like a unique scenario or what, but I did send out the programs that I was really interested in and that I hadn't heard back from. I did send out interest emails, and it was very brief, and but that was after a lot of like thorough research, not just looking at programs kind of superficially, but say like programs that I really was able to identify a myeloma mentor that I could work with. I did send out interest emails, and I would say that I actually got interviews from at least 50% of the places that I sent out interest emails to. So they were just, say, for example, like in Karmanos, I remember distinctly that I got an interview after I sent an email to the program director, and I just wrote that there's Dr. Zonder over here who's like a myeloma amyloidosis person, and that I would be happy to, like, I have identified him as a research mentor and I would love to work with him. And also that I have some family here in Michigan. And so just kind of like unique things that you would really put above other things and other programs that would help you. And so if there is some programs like that, I would say there's no harm in shooting an email. So I did send an email to like the program director of like some programs that I was really interested in, and I did get some extra interviews from that. So it's worth. I would say I remember doing that even as like a residency applicant, and I don't think I ever heard back from anybody. But I guess once you've done residency, you're kind of more of a colleague than like an applicant. And so I think a genuine interest email would be looked at differently. Again, I'm not saying like to send mass emails which are not specific or unique, but if there is programs that you have identified as that could be great opportunities for you because you have like family ties or a particular mentor that you've identified, I would say give it a shot and send an email.
This is actually a very surprise addition because we've heard mixed reviews about sending interest emails. Some fellows have actually said, look, it doesn't work, but it's encouraging to hear from you that it's worth if you have a genuine reason and a person that you want to work with. And Matt, did you send any emails of interest or thoughts on that?
I sent letters of intent after the interview. I sent one specifically here to Florida because I was really impressed with the program and what they had to offer. And I expressed that in the letter. And my program director has mentioned that to me that really helped my standing in the rank list. So I will say yes after the interview. An intention email is worth it as well.
So in terms of a letter of intent, is that a separate letter on an official letterhead, or you're just writing an email? Look, I had a really good time getting to know the program. Like what is an outline of a good letter of intent?
So yeah, for me, it was just an email. I didn't want to I think the biggest thing you have to keep in mind is that these program directors read hundreds of applications and personal statements, and they're also probably working full time, and they have other fellows that they're taking care of as well. So you really don't want to have them to do more work than necessary. So I think, so what I did is I just did like a very short email. I said, like, thanks for having me. I appreciate the interview. This is what I found in your program that really stood out to me. I'm very interested in coming to your program. I'm going to rank you highly, etc. I look forward to talking to you in the future. And that was really about it.
Any thoughts on that, Dr. Parikh?
Yeah, no, I totally agree. So I know that there is mixed reviews about that. And I remember like my own residency program director talking about it, that he gets really annoyed if people email him. But I think that is also because residency is a much bigger pool of applicants. It's like thousands of people applying, and they're already like interviewing about 400 people, but they get like a lot more applications than that. So I can imagine if like everyone started to email the program directors, that can totally be annoying. I know that. So yes, do not send mass emails. Like definitely only if you have like a genuine interest and something that like really like you makes you want to rank that program very high or get a chance to interview at, then I think that you should kind of make that interest known. And yeah, just a short brief email. Don't put any attachments, because I know that a lot of attachments can sometimes get into the spam folder. If there is like big attachment files or so, do not put any attachments. You can put your AAMC ID number, so that way they can look up your application. I personally, I don't think I attach CVs in those emails. I would just put my AMC ID number. They have your application. They can open it if they want to. And I think I remember like getting like a couple of interviews where I was even waitlisted. So just because like I sent an interest email and somebody canceled, like I was put on the wait list, and then I actually ended up interviewing there. So it helped me. And so that's why I would say that if you, yeah, weigh the emails. Do not send 50 to 100 emails. Just like a few programs, handpicked programs that you think you would be lucky to interview at. Go ahead and do that.
Okay, that's good to know. Thoughts on having your program director or a mentor call or advocate on your behalf? Did you have that? Do you advise for it?
Yeah, I think I don't think I think actually like I was a bit late to ask that, so I don't know if I can answer that question accurately. But by the time I asked like some of my mentors to like make phone calls or write emails, it was like November, and so very close to like rank order list submission. And so I think a lot of the programs had already finalized their rank order lists. And so my mentors gave me that feedback that when they called the opposite program director, they said that it was like already too late. So I don't know how much it helped. I don't think it helped my application, but if that's something that you would want, then maybe mid-October or third week of October, I think is a good time. Do not push it until November. And I would say it should just be to your top 5 programs. I wouldn't make my program. I think that would also be a lot, like depending on the comfort of your residency program director. So, like, yeah, maybe they would offer to call like your top 3 or your at the most your top 5, but it's not going to be all programs. So you got to already have a priority list or like a preference list in mind, and then you ask them to make calls for you. But again, I don't know how much it would help because I was late.
Thank you. How about you, Matt?
Yeah, personally, I did not do this. Talking with my current program director, he's told me that he's received probably at least a dozen or so emails from mentors for different applicants. Talking with him, it doesn't sound like it influences him that much in his selections for interviews. But I mean, you have to look at this in kind of the broad picture too, is that you've worked your entire life to make this dream a reality. So if it's something that you feel that you should do for, again, 1 or 2 programs only, I mean, I would go for it. What do you have to lose at this point? But yeah, I would say I totally agree that, mass emails, mass calls, definitely not a good look for your mentor or the programs that you're reaching out to. So
I'm going to open the floor to, we have about 30 residents, so really great turnout. If any one of you guys want to ask, please go ahead. Just unmute yourself and ask, guys. I'm just going over the questions that you guys sent me, but floor is yours. Okay, while you guys think that, questions on, so are there any questions that took you by surprise? Apart from the classic questions that we need to prepare, why Heme? Tell me about yourself. What are some of the questions that you faced that you thought, okay, that's kind of new, or, this is, yeah.
Yeah, so yeah, some programs will ask, or some people would ask funny questions, but I don't think you can prepare for any of those. Honestly, you just have to like kind of use your presence of mind and answer that question. But yeah, let me start with the standard questions that you should be prepared for rather. And I would say, yeah, tell me about yourself, and then yeah, why you chose Heme. And then the most common question other than that is like, tell me about a research project that you worked on that was really close to you or that you really enjoyed working on. And I would probably, and again, I think this would be more commonly asked in like a university program, maybe like not as much research probably is not as much of a focus for community programs, but definitely, university programs would definitely ask you this question. Yeah, so what is like a research project that you worked on that you really enjoyed working on? And I would pick a project that you are first author on, and you should have ideally at least one first author project. And I wouldn't pick somewhere where you were like the nth author. Somewhere in the sequence, I would pick a project that you've really worked on start to finish, and or even it may not be published, but if that's something you're working on and you feel comfortable sharing, I would pick that project. And then the other thing would be why us? So the program is going to ask you like why did you pick, say, Michigan and or like Carmanos? And so you got to have a reason for that. And then what are your 5-year plans, or like where do you see yourself in the next 5 years? And so if you have an idea, like for example, for me, I had an idea. I knew going in that I wanted to do multiple myeloma, and so I would probably end up in an academic place with a disease focus in multiple myeloma. So if you have an answer, that's fine. If not, I think it's totally fine, because I don't think many people know. But you could be honest and tell them that if you're leaning more towards private practice or if you're leaning more towards academia, you can say that, but it's totally fine to not know. So I think those are like the most common questions. And then what do you like to do outside of work? I think that's another common question that you will be asked. And I think interviewing is a very interesting game, I would say, that needs to be played right. And if you are interviewing, and this is, I think it was like a mistake that I did make in the initial interviews, but I kind of like learned for myself. But if you're interviewing at a place that really does not have what you're looking for, I would change my answer. So for example, I'll give you guys an example. So I interviewed at Boston University, and they have like a huge amyloidosis program, and that's why I was particularly interested, because it's like plasma cell dyscrasias, and they do a lot of their auto transplants in house, but they actually do not have like a allo transplant service at all. And so their fellows rotate through Dana-Farber. They have a tie-up with them, so they go for like a 1-month rotation to Dana-Farber. And at that time, I was working as a BMT hospitalist, and so I was interested in BMT or stem cell transplant. And it's not the case anymore, but at that time it was. And so I very heavily, when they asked me this question, where do you see yourself in the next 5 years? I was just being honest, and I was like, I want to probably like be in an academic setting and work as a transplanter. And the associate program director was like, well, then is this really a good program for you? Because, you're going to have only 1 month of exposure here at Dana-Farber. It's not going to be like a very good or strong exposure to allo transplant. So do you think you would like still like this program? So I immediately realized that, oh my God, like I should not have probably said that, because at this point, like it's more important to get into a fellowship program and not be so focused on allo transplant exposure particularly. And like it turned out right, because now I don't even want to do allo transplant. Like I rotated through that department, and I am like, it's not for me. So it would have really not mattered if I would have gone to BU and got the great exposure in amyloidosis and things like that, but yeah, and not that much exposure in allo transplant. It would really have not made any difference. But I think that I kind of made them feel that their program was not a fit for me. So I think you've got to really, really be smart about what you are answering where. At the same time, you've got to be honest. I'm not saying that you've got to like make up something that is not true, but kind of modify your answers at the same time. Like, so even for smaller community programs that I interviewed at, which were really geared more to teaching for private practice, like basically most of the like smaller community programs are going to be strong in solid onc, because that is like the bulk of pathology. They're like colon cancer, breast, lung, prostate, like that's going to be their bread and butter, and that's what they're going to be good at, and that's what they're going to teach you. And so if you go there, I remember, I think the other one was like LSU Shreveport, and that program at that time, like 3 years back, did not have like their transplant service was down. Like the entire program was down because they lost like 2 or 3 of their transplanters. And so they just did not, like their transplant program was shut. So they were not doing any transplants. And then I go there and I'm like, oh, I want to do malignant heme and transplant. And, like, it's not going to work out. Like, they're going to know that this is not a right fit for you. So I would say, like, be careful about that. What are your 5-year plans? Like, you got to be very careful about where you are interviewing. If it's a university program, you can say everything because they're going to teach you well for both private practice and academia. If it's a community program, be careful about what you're saying. So I think, yeah, these are the common ones that I was asked. And then some weird questions. I would say one program asked, if there's something that you could teach me in the next 3 minutes, what would it be?
Oh.
So yeah, so I think some people like taught them a phrase in Hindi or like, their language, or some people taught them like a recipe, food recipe or so. But I think it was just like a fun question. And then like say the other different one I would say is, if you were to be a chemotherapy drug or an immunotherapy drug, what would you pick? So these are like random questions. You cannot prepare for these. I mean, you just have to use your presence of mind and come up with something really witty. And most of these, you're not going to be judged for answering this question one way or the other. It's just going to be like an icebreaker or like a way to kind of smoothen the conversation or have fun. And many times these might be the fellows that are asking these questions, just to have fun. So I think you just sort of keep your presence of mind to answer these questions. And I don't think you can really prepare for these, I would say.
Chemotherapy drug. Okay. How about you, Matt? Interview questions, tips on, what questions you faced. What are some of the surprise questions you got?
Yeah. So personally, I wasn't asked anything about my research or my publications, which honestly surprised me. But yeah, definitely be prepared to talk about your research and your publications that you have. And I think I got a lot of similar questions too about where do I see myself in 5 years? Why Heme? One question that kind of made me think a little bit was, why do I think I would be a good oncologist? Or what experiences do I have would set me up to really help these patients with new cancer diagnoses? And that was a really interesting question. I felt I wasn't prepared for. In my personal statement, I talked a lot about the Lord of the Rings. So I got asked a lot of questions about that, especially like, how would you apply Frodo's carrying the ring to Mordor to being an oncologist? And I'm like, I don't know, we're both trying to destroy something, So definitely know your personal statement. They will ask you about it. I also have 3 kids, so I got asked a lot about how being a father will help me be a better clinician for these cancer patients. Yeah, it definitely ties to the program. Why did I apply to this particular program, especially since I have no ties to Florida at all? Why did you apply to Florida? And I really wanted to just say, because I went with the shotgun approach and you guys invited me for an interview. But yeah, just have a good answer for all those simple questions that you'll get. But as far as like really strange, out of left field questions, I think some of the fellows asked me what my favorite food was and how and how that fit into my life, or just weird stuff. But there wasn't anything off the wall like residency. I really got the vibe when I was interviewing that I had already impressed them enough with the application that the interview was just a formality to sit down with me and to really get to know who I was as a person, to basically prove to them that who I wrote down on paper was actually what they were going to get. So I don't think, as far as fellowship interviewing went for me anyway, that it was, okay, how can we weed this person out? It was instead, how can we get to know this person the best so that we know that they're either a good fit for us or we're a good fit for them. So I would definitely approach your interviews with probably some more calm than residency, just because you have that in your back pocket. You know that they saw something in your application that they liked and they wanted to talk to you more about it, or they just want to get to know you better. So that's in your favor, I would say.
Okay. And once you finished interviewing at programs, what advice do you guys have for post-interview communication? How frequent, if there's more than one, or what did you do?
I think, yeah, as Matt mentioned, that interest email, I think I sent an interest email to my top 5 programs. I did not mention, I just said I have ranked you really high. I think we're not supposed to mention that we've ranked you like 1 or 2 or whatever, like the actual number. But I just mentioned that I've really ranked you all high, and you're one of my like top programs. Also, and I just did that for like the top 5 programs that I liked after interviews.
What about you, Matt?
Yeah, I wrote that intention email. I would say, let's see, when's the rank list due? Is that like November, I think? Or maybe I think I waited till probably closer to the end of September, when I knew that they were really starting to think about their rank list and trying to get that together. I did receive correspondence back from each of the programs I wrote an email to. So yeah, I think I would wait probably until like middle to late September.
Okay. And so this is Matt, I know you just finished interviewing. Anecdotally, from what you hear, what are some of the big no's that program fellowship directors tell you, like, please don't do this at the interview? And Dr. Parikh, if you've seen other people interview at your program right now, like some red flags, like, please don't do this, what advice do you guys have regarding that?
Sure. So the number one big red flag that my current program director told me was, you have to be cordial and pleasant to everyone you interact with on interview day. So last year when I was interviewing at the program, he told us that some of the interviewees were rude to the program coordinator, which kind of shocked me, because why would you be rude to anyone at this stage in your life? But yeah, so then after the interview was over, she's like, yeah, they didn't treat me very well. And he just immediately took them right out of the running. So make sure you're cordial to everybody. Make sure that you show up on time. I mean, that shouldn't have to be said, but it's just a good reminder, be on time, be professional, look your best. Don't make inappropriate jokes. Just the basic stuff.
Yeah, I think I would agree. So, like Matt said, that this is a very different ball game as compared to residency interviews. They treat you like more as colleagues, because if you were not to apply for a fellowship, you would be practicing independently. So you would be like a hospitalist, you'd be a primary care physician. So they treat you as a colleague, and the interview process is more to just figure out if you are a good fit for them, as much as they're a good fit for you. So once you have gotten an interview, I think do not sell yourself short, like go for it and try and assess the program as much as they're assessing you, because I think it's like a fair game. And then, don'ts, I would say, like small tips, because these are like virtual interviews, and we attend like the Q&A session with fellows often. So I would say, like, make sure you're like, if it's Zoom, I don't know how to do that on Microsoft Teams, but if it's Zoom, you can change or like move your active speaker window right underneath your webcam. So somebody actually gave me this advice, and that is very helpful, because you try subconsciously, you keep looking at yourself on the screen, and so if that box is in the down right corner, the opposite person is going to think that you're not making eye contact and you're looking away. So when we're all sitting in like a boardroom and we have like the Q&A session with the fellows, it many times, and again, you guys are not doing anything deliberately, but it just happens that somebody just appears to be looking down all the time and not like making eye contact, or like the camera is not appropriately like focused. So basically the key is like to keep making eye contact, and like Matt said, that appear genuinely interested, or you should be genuinely interested, like I guess, to assess the program, and engage in conversations. Don't kind of like feel not interested. Basically, that's not the vibe you want to give in these interviews. You may be tired. Some interviews are really long and it's multiple interviews, so I get it. Like Zoom fatigue is real, but just try your best to make eye contact, make sure your camera is properly focused on you and you looking straight in the camera, and appear interested, and engage in conversation with everyone, I would say.
Nice. Really good tips. So what are some of the questions that we could ask fellows? Like common questions that come your way?
So I think that what you should try and determine is what is the culture of the program, both in terms of like collegiality, like between amongst the fellows, and also with leadership, program leadership, and faculty. So I would say some good questions to ask would be, what do you guys do as a group after work? Like, do you guys hang out, or those are like some questions you could ask. And if you were generally interested in knowing more about the city, then, I'm sure you can bring up those questions, like where do most people live in cities, and what are the fun things to do, like in Detroit, and what is kind of like the average property rental prices, what are kind of some childcare. Those are all the questions that we get asked as fellows, like is there any facility for childcare? Because I know some programs do provide that, like a daycare, which is affiliated with the university or so. So I think those are some questions. And then, about faculty, I think, what is kind of like is there a formal mentorship process? That's a question you could ask, where because some programs do have that, where like a person is assigned to every incoming fellow. Like one of the faculty mentors is like assigned to you, and they're kind of like your buddy that you can like seek help from and you meet with periodically. So some programs have that formal mentorship kind of a thing. Other programs don't. So that's a good question you could ask. If there's any specific tracks, I think that you would know from the program overview, because many programs have that clinician educator or physician scientist or clinician investigator type of tracks, which are separately laid out. So of course, that would be explained to you in the program overview. And then another thing that you could ask to just kind of know how open the program is to changes would be like, what are some things that you guys did not like in the program and that were changed? I think that was a good question that I would ask usually, like just to know, like, is the program open to feedback? Is the program director or program leadership open to change? And so what are some things that you did not like is as important as what are some things that you like. So I think like asking that question is also important, that what is something that you would like to change about the program, or something that you have changed about the program. So I think those questions. And then to the fellows, you could ask this, and I think it should be important. I did not realize the value of it, but I realized after matching that what is kind of the structure or job description of the fellow when you're on the consult service. So there are some programs that are going to have the fellow or Heme as primary. And so all the patients, so they have like a malignant heme service, they have like a solid onc service and like a BMT service usually, or like a BMT and malignant heme services combined. And you like hemonc is primary, so the hemonc attending rounds on the service, and then you as a fellow may be primary on these patients. And that is very important to know, because then you're expected, you may have some residents working under you, but you may be expected. So one of my friends in another program, she was in a program that had that kind of a structure where she, like felt hemonc was primary, and they would have one intern and a nurse practitioner. Both of them had like a cap of 5 patients, and the team itself had no cap. And so the team had like 30 patients or 30 plus patients, and the fellow was primary. And so expected to do admissions, discharges, go to social work meetings and things like that. And so, that is overwhelming. And you got to at least, you got to know that coming in. And that may not be a lot of like forthcoming information coming from the fellows, because, that's going to scare you guys. So I don't know if many people would be very forthcoming about it. So I think it's important like to ask. So the way my program is, and I'm so thankful to the program, is that medicine is primary for everything. And so we are just consultants. And so there is like 2 resident-run medicine teams, which have like their medicine academic attendings rounding on them. And then we are consulted by default on all of those patients, but we are consults. And so we basically just round on the patients and then give our recommendations, but it's their responsibility to order, and we don't have to do any admissions or discharges or so. And then, so that's true for all of them, like malignant heme, solid onc, and BMT. Malignant heme, I think we could have even been primary, because we are very actively managing those patients. For leukemia, lymphoma, we're giving them chemo, and we are micromanaging kind of. So I think it would have been fine if we were primary on the malignant heme service or BMT service. But on the solid onc service, most of the times patients are there for like complications of chemotherapy or new diagnosis or like mass effect from their tumor, which is medicine stuff, so they could handle that very well. So I think it's important to kind of try and find out what would be expected out of you as a fellow. And maybe that can help you rank your programs accordingly, where if you're going to be primary, I would say that better rank another program, which is where you're not primary. And again, this is not to shy off of work, but I think that this would just take away from you learning at hemonc as a fellow, because I did this. I worked as a hospitalist, and I did all of this as a hospitalist. So a lot of this is like medicine stuff, which you have already done in your residency, and that should not technically be expected out of you as a fellow. And if you are expected, then you're probably it's going to take away from your learning time as a hemonc fellow. So be careful about that, and kind of try and ask about it. And that will help. If 2 programs are appearing the same on paper, then maybe something like this can help you decide how you should rank these programs.
So just to clarify for my crowd, I'm getting a lot of questions about this. So we're asking about your hemonc inpatient service. What is the fellow's role? Are you being a consultant, dropping specifically hemonc evaluation and making your recommendation, or are you expected to do a full admission and do like a regular inpatient?
Are you primary? Yeah. So I think the question should be like, what is your role as a fellow of the inpatient service? I think that's what you should ask. Like, are you primary or are you a consultant? I think that's what you can ask.
Matt, any thoughts on questions you asked, fellows versus faculty?
Yeah, I think the only other thing that I would add to that is I made it a point in each of my interviews to find out exactly how much time I would have during the workday to read and to actually learn hemonc. You'll find a lot of programs are workhorse programs where, fellows are either in clinic all day long, or they're in clinic in the morning and then they go around in the afternoon if they're on the inpatient service. So it's really important to determine how much time you're actually going to have during the week to read and to study.
Did you ask that to fellows?
Yes.
Okay.
Yes. Because the fellows will tell you, like, they'll say, oh, we have 3 or 4 half days of clinic a week, and then, we have time to, finish notes and follow up with patients or read about different topics, which is helpful. a couple fellows are very candid with me and said, you know, there isn't a lot of time during the day because we're doing so much. So it's just another piece to help you decide where you would like to go. So my program currently, when I asked them that question as well, they were very quick to say, you know, he's very good. Our program director is very good. He doesn't let us get overbooked in clinic. We only work a couple half days a week, so we have a lot of time to study. And something I didn't know, which is, I guess, becoming more prevalent in HEMONC programs, is that they're having like specific half days set aside as more like a study hall to just read up on things. Whether that's in-house or on your own, it's program dependent, but it's just something to know, like if you want more time to read and not just see along every single day, I think it's good to know that as well.
You know, we just crossed the time, but I'll wrap my session with one question to each of you. What do you like about the program at UF, Matt, and Dr. Parikh? What do you like about Karmanos' program, and why we should pick your program?
Matt, you want to take this first?
Sure, I can go first. So I love the University of Florida Jacksonville program. It's absolutely fantastic. We are given a lot of support to really take care of our patients in the best way that we see fit with that supervision. I really love how supportive the faculty are. As I just mentioned, they gave us a lot of time to study and actually learn HEMONC and ask questions and really try to become the best oncologists that we can be, which is just fantastic. So if you're looking for a program that you're going to learn a lot, if you're looking for a program that's going to really help you grow into the hematologist or oncologist that you want to be, I think UF in Jacksonville is really a good look. And we do round, I think, 2 months out of our entire fellowship at Mayo, right down the street. So it's really helpful as well. So we get a lot of good experience in that way as well. But anyway, thanks for having me on. Thanks for the questions. I hope we were able to answer them all. If you need anything, you can always send me a message on Twitter. I'll be more than happy to respond to you.
Thank you, Matt.
Yep.
So we'll wrap with you, Dr. Parikh.
Yes. Yeah, and nice to chat with you, Matt. And yeah, so my answer to the question would be, I would say like 3 things about Karmanos that I really liked. The topmost is the program structure, like I said, in terms of the role or in terms of the stuff that is expected from us as fellows is so much focused on our learning. So even in our outpatient clinics or like on the inpatient BMT side, where we are actually primary, there is 5 nurse practitioners. So all of these services, like I would say outpatient blocks. So we have like disease focused practice. So it's like GI oncology, thoracic oncology, breast oncology. So all of these are fully functional without the fellow. So the attending has like a nurse practitioner or a PA, and then they would see the patients by themselves. So the fellow is clearly there to learn. So of course it's a help if the fellow is being able to write some notes and see some patients, and then that way the attending doesn't have to see the patients by themselves. But if the fellow is not there, like if you have to take time off for personal reasons, medical reasons, whatever it is, but they're able to fully functional without you. And I think that kind of like makes it a very educational experience because you're there just for your education. And the second thing, so like the entire program structure is amazing. We are barely on call. So I think, yeah, the program structure is amazing. The second thing is the people. My program director, Dr. Diol, is like literally like a father to all of us. He's like a cool daddy person, and we could go. He truly has like an open door policy, and we can really go in and talk to him about anything. Like it could be personal life issues, it could be like career issues. He really like wants the best for all of us, and he's very open to suggestions. We have systems conferences, like I think once every quarter, so once every 3 months, where we meet with like the program director and the program coordinator and just literally bring up issues, any issues that we have. You guys must have that as part of your residency program, and so something like that. And so we can bring up any issues, and really things get changed after that. Like, I mean, of course, not all of them. Some things that require like more to be done from the administrative standpoint, which is kind of beyond your Heme fellowship program, may or may not be done. But whatever is in his jurisdiction, so to say, he's very willing to change that and very receptive to feedback. And so yeah, all of the faculty members are great. Very easy to find research opportunities and work with any of them. So I think the people and then the program structure, I think, are the best things about Karmanos.
Thank you, Dr. Parikh. We're very grateful that you spent a lot of time with us and gave us wonderful advice. Couldn't be more thankful to give us this 1 hour on a Saturday. I hope that all participants benefited from this. I'm getting a lot of feedback, so I will get back to you, Dr. Parikh, specifically on questions that come my way.
Yeah, absolutely. You can text me, and then yeah, I'm available on Twitter, and yeah, you could reach out to me with any questions that you have. Of course, happy to help.
Thank you, guys. Have a wonderful Saturday, and see you guys with the next session sometime later.
Sure. Good luck, and everyone's going to do great. I do want to say one last thing, that I know you guys are really, really stressed right now, and I was too. But trust me, I think that this is overrated. I think you're going to do good no matter what. You're going to end up in a good place. And I think even if, God forbid, like this should not happen to anybody, but if God forbid you go unmatched, really, this is not the end of the world, you know, guys. You guys are like internal medicine. You pick up a hospitalist job, you work for half the year, earn tons of money, and you don't have like a lot of responsibilities on you. So like, you know, right now when I go on a vacation, I sign off my pager and I have to sign out all my clinic patients. I have to find coverage for all my clinic patients. Whereas when you're a hospitalist, you just literally sign off the pager and you're done. Nobody's bothering you. So I'm saying that the other side is not as bad as you guys would think right now. But, you know, so it's not as bad as not matching for residency, because then you're kind of like, oh, what do I do with my life? But, you know, now it's like a different scenario. So like, do the specialty only if you're really, really passionate about it, not with a view to earn more money, because I do know that you can earn a lot of money by doing locums or by doing hospitalists. So if you're getting into this fellowship just to earn more money as a specialist, I think that's not the right reason to be in this specialty. Do it for the right reasons. And then if you say, for example, don't get in, do not take that personally. I think there's a lot of things that go on this side that we are just not aware of as applicants. So for example, like somebody in the program, like in the whole Department of Medicine wants to hire like a cardiologist, and his wife is applying for Heme fellowship. And there is pressure from the cardiology department to rank that person. So, and then this year there is 5 internal applicants for 3 positions, and then they all want to stay back. Versus another year when there is only 1 internal medicine applicant, and she doesn't want to stay back either. So there's a lot of random things that go into this match. So don't take it personally, I would say. Just like, you know, like do your best, give it your best, and then like, if it happens, that's great. If not, you can always try again. And if you don't want to try again, you can make a lot of money and work half the year. So that's not a bad deal at all, you know. So like, just chill out. I think it's all gonna end well. And yeah, don't stress out too much. I think it's all gonna be all right.
Thank you, Dr. Parikh.
Yep.
Bye, everyone.
Bye.